I think that Fetch is the best choice for surgical services because we offer a wide variety of specialists at the hospital. So when your pet comes in for their appointment or their surgery, they're not just under my care, but they're also under the care of a wide range of specialists, which allows us to truly provide comprehensive care for your pet.
So at Fetch, our services are not just limited to the specialists that you refer to. So when you send something for surgery, if it needs more intensive care, we have the ability to involve our criticalists or oncologists or internal medicine, depending on the specifics of the case. And that way we can have a collaborative approach to achieve the best outcome for the patient.
One of the big benefits of your pet's care here at Fetch is that we provide a very collaborative environment. So if your dog or cat comes in for a type of cancer and sees our oncologist, then he's right here in the building to talk to me about your pet's surgery. The same goes for your pet's follow-up care after the surgery. Your pet is cared for by our critical care specialists in the ICU, and the care is continuous as your pet needs further care down the road.
We see a range of cases. A lot of things come from emergency that are really sick, and so we might be doing abdominal surgery to remove a ruptured mass. We might be going into the chest to remove an infected lung lobe. If there's been vehicular trauma, then you could see a lot of fractures. Some of the advantages that Fetch has technologically is minimally invasive equipment such as arthroscopy and laparoscopy. Additionally, we have something called a C-arm, which is a mobile X-ray, which allows us to image bones during surgery to ensure that we have the best reduction of fractures and placement of implants. Beyond TPLOs, we do a lot of cancer surgery, including removing skin masses or abdominal masses, masses in the chest associated with anal sacs, or in the head and neck area. When a client is bringing their pet to Fetch because it needs surgery, naturally that is a very anxiety-inducing event. The goal for me when I see a consult and throughout the care of the pet is to try to minimize that anxiety for the owner and also for the patient as much as possible. My number one job is to take care of the patient, but a close number two is making sure that the client is educated about the procedure, about potential complications, and has all their questions answered every step of the way. Just because we've done the surgery and the pet goes home doesn't mean that the relationship is over. So we are always available if there's any questions or concerns once the patient goes home.